Hello and welcome to Sleep is My Waking Passion, the podcast where we get real about sleep and how it shapes your life. I'm Dr. Allison Cole, a triple-boarded pulmonary critical care and sleep medicine physician who's learned to thrive despite having chronic insomnia. And now I'm here to help you do the same.
Hello, everyone, and welcome to a new season of the Sleep is My Waking Passion podcast. You guys know who I am. I'm Dr. Allison Cole. I'm the host of this little podcast, and today I have a really cool guest with me. I have Dr. Praveen Vohra. He is a pulmonary critical care and sleep medicine specialist, very similar to me. He is with Ascension Medical Group. He was previously in a private practice for a number of years. He's based in Carmel, Indiana. He's completed his residency at the State University of New York in Buffalo, and his fellowship was done at the University of Pittsburg. So welcome, Dr. Vohra. It is great to have you. I just want the folks to know here that Dr. Vohra and I connected because Praveen has been one of the members of the AASM Advocacy Committee, and he has served on other committees with the AASM, and he's really passionate about how we can move the needle on improving access, improving how we're approaching sleep medicine. And today's topic is very, very timely. Many of you do not know that this whole telehealth thing, being able to talk to your doctor, be on video, chat with them remotely, it is something that's really changed my life in terms of how I'm practicing, and I've been using it for years. But many of you don't know that it's one of these things that was sort of granted and became mainstream during the pandemic, and is in danger of being terminated. Like, this service that we know helps is in danger of being terminated. So Praveen has been on the committee that basically has a position statement about the importance of considering permanent telehealth for sleep medicine. And we're going to talk a little bit about why that's so important. So welcome, Praveen. It's so great to have you.
Thank you, Allison. Good to be here.
Yeah. So I guess I would start by, can you share with our listeners just why did you decide that we needed to push for this permanent telehealth agenda? I'm alluding to it, that it's in danger of going away. But what are the benefits of having telehealth available to patients? What have we seen?
Telehealth has become very, very useful and helpful in healthcare, especially proven by the COVID pandemic. When the COVID pandemic happened, as everyone knows, not only just the country, but the world kind of came to a standstill, and access to essentially any service became very, very difficult. Fortunately, telehealth was being developed even before, but the Medicare waiver 1135 really helped open it up so that people could have access to healthcare. And that helped take care of patients remotely, anywhere from taking care of them from clinical question standpoint to renewal of medications, controlled substances, and such. And it has proven the robustness of this model, which has been universally accepted so far with the support of multiple payers, patients, healthcare systems, and physicians.
Is there something unique about sleep? I have my biases because I am a sleep telemedicine practitioner, but are there some unique features about sleep medicine that lends itself particularly well to providing care for patients via telemedicine?
Yes. So there are quite a few things. One of the main things is, for example, in sleep medicine, we don't have to do a very thorough, detailed physical examination. So the patient doesn't have to be physically present to make a diagnosis. For example, as you know, you're a pulmonologist, I'm a pulmonologist too, and we would listen to the patient's heart and lungs when they come into the office. In the practice of sleep medicine, we don't have to do a detailed examination like that. So that's one aspect of sleep medicine that lends itself to telehealth. The second aspect of sleep medicine is management of diseases such as sleep apnea, where we can now do telemonitoring, and the telemonitoring doesn't require the patient to be in the hospital, in the office, either, because we can download CPAP, BiPAP, ASP machines remotely and give feedback to the patient and help them use consistently. The other aspect in sleep medicine, as you know, we prescribe a fair amount of substances such as amphetamines and armodafinil and drugs like those, which are controlled substances for hypersomnia and narcolepsy. With telehealth, we can interview the patient, get to know how well they're doing, prescribe the drugs. So these are multiple aspects that are helpful from a sleep medicine standpoint. Insomnia is another biggie. We know that CBTI, the cognitive behavioral therapy of insomnia, can be done in the office, but now we know that from an outcome standpoint, the outcomes are pretty comparable to doing it by telehealth. So all these things lend sleep medicine to be done in a very efficient fashion via telehealth.
And I would like to add to that I think we can often get a sense just from having a detailed conversation with a patient, which telehealth sometimes allows us to go a little bit further in terms of that, having a longer discussion, because there's none of the usual check-ins that may eat into some of the time that you have when the patient's in the office, medical assistants, for example, that, you can kind of run through things a little bit more quickly. And what I have found is I can usually really tease out and have a great discussion with patients about, hey, these are maybe the strengths and limitations of considering home sleep apnea testing. How do you feel about that? What the difference is between one night and multi-night, and it's important to coordinate for in-lab testing as well in your local area for where that patient is. But it's also, at least from my perspective, allowed me to manage patients and treat them from multiple states, because I have licenses in 4 states at this point. So it's been really nice to have a mishmash of patients and kind of learn that the culture is different in different areas too. If I'm talking to somebody from Georgia, they're very different than my California or my New York, New Jersey patients.
Yeah, I would agree with all the points you said. I think great points, Allison. Very correct. And with these interstate medical licensure compacts that are being made, getting licenses in multiple states has become easier. As you know, you need a home base to have a license in a home state. And then once it belongs to a compact, you can get access to licensure in other states too. So I think that's fantastic. And it's great to hear that you're servicing population, which is actually one of the major strengths of telehealth, because there is shortage of essentially all physicians in the country, definitely in specialties. So access becomes easier to patients across states, and that's another very big strength of telemedicine.
And I do think that even if you're doing some sort of a telemedicine practice, even if you're in real time with the patient as well and kind of doing that, I have found that using some of the contemporary technologies, the technologies that would be more considered a commercial product, sometimes they've been somewhat helpful in that I incorporate them into my practice. For example, if I am begging a patient to do a sleep diary, and maybe they're kind of doing it, but not really, and then they're struggling with their sleep, I've been able to pinpoint certain things just by saying, all right, I'll take your Fitbit data. If you're willing to share that with me, go ahead and share that. Have you found any utility to being creative in remote monitoring in those situations, out of curiosity?
Yes. So as you know, the wearable devices have become so common. There's not a single day in the office where a patient wouldn't bring something that they have downloaded on an app on their phone from a Fitbit device, an Apple Watch, a Samsung Watch, Garmin, and so on and so forth. And they want to go over, hey, this is what my sleep showed me. This is what's been showing for the last week. So there are several advantages to this. One disadvantage, but several advantages. And my opinion, the biggest advantage is that the patient is now interested in his or her own health. They want to monitor themselves. They want to do a deeper dive into their sleep. That engagement is very encouraging, because for the longest time, people were just putting everything in the hands of the provider, the nurse, the doctor, the nurse practitioner, till they told them something, the patient wasn't engaged. So that's a wonderful thing to see. There is a position paper from the American Academy of Sleep Medicine in 2018 alluding to what should we do with these devices. And the general sense from that paper was, and that's the position paper too, is that we can't really make medical decisions based on that data, but we can help understand what the trends, for example, as you said, sleep diary, the patient is doing. So give the patient some feedback on that. So I consider it a strength. I think it's still evolving, and hopefully we'll have more fidelity in these devices that we can actually rely on data. So we'll see how that evolves, but it's certainly a good tool to speak with the patient about.
What are your concerns if sleep telemedicine were to go away? Like, what do you, what are you worried about for your patients or our country, really?
Yeah, so I think if there was one huge, big concern would be access. It's going to cut off access for millions of people, whether it be, and since you're asking about sleep telehealth, patient will have to come in to be seen, to be directed, to be helped, which includes several negatives. One, they have to take time off from work. If you are a home-based parent, you have to arrange childcare for your child. If you have bad weather, you have to cancel that visit, and that visit will then be postponed, which decreases the efficiency of an office because it takes a spot somewhere else. The other economic impact, time off from work. So if you don't get time off from work, that's a problem. The difficulty in driving. And a lot of our patients, a big percentage of our patients have hypersomnia or excessive daytime sleepiness. So just think about a patient with narcolepsy who doesn't really want to drive 30 minutes from a semi-rural area to a city to be seen and gets into an accident. So those are all not just hypotheticals. These are the realities that will come into play if sleep telehealth is, or for that matter, telehealth in general is taken away. Sleep is part of telehealth.
And I also think it's much easier, and I'm sure you probably have had situations like this too, where, like, let's say someone really is having something that's concerning and you just want to address it as quickly as you can. It's really easy to be like, all right, I'm going to stay and do a quick visit with them. I know I can help them. I know I can pivot much more easily within my schedule or include them in that process of discussing a concern of theirs in real time, as opposed to what's my schedule like? When can I fit you in?
Agree with you 100%.
Yeah, for sure.
The ease of this is so beneficial, and I'm sure you have had feedback from your patients, and I get feedback from my patients all the time that they are just so grateful that they don't have to visit to be seen for something that's not very complicated.
One of the things you alluded to, and I want to get back to access a little bit, because I think we would be remiss if we didn't also describe the health equity component of minimizing that access for some folks. Do you want to talk a little bit about what you and your committee have uncovered in terms of the importance of to provide access to people who otherwise would literally remain unseen?
So there are many populations that are hard to access, rural being one of them. So in rural areas, it's hard to find specialists. So they have to travel miles or tens of miles sometimes to go see a specialist. So that population gets underserved. Then there's the population that can't really afford smartphones or cell phones or have a computer, and they have phones that they communicate verbally. So the audio aspect of telehealth is also very important for that population. They either live in an area which is hard to access, broadband access is an issue, audiovisual connections are broken, but the cell networks can do a phone call. So those two populations are biggies, those that are far away from healthcare centers, those populations that can't afford the technology or even broadband for that matter. They can afford a cell phone, but they can't afford to connect to Wi-Fi, for example, or have a data plan that will give them, say, X number of gigabytes at a very low price. So telehealth does help, especially the audio-only part, which was in place till 2024, at least December. which has helped access that particular segment of the population.
So it sounds like what we're advocating is not just for the audio-visual, but also to allow for those ongoing conversations for people who quite simply may be technically challenged for a variety of reasons that you laid out, for sure.
That's correct. That's correct.
I guess my next question for you would be, can you speak a little bit to what the importance is in terms of the potential for cost savings if we take a more macroscopic view of healthcare and say, hey, we have a serious situation of obesity, of untreated obstructive sleep apnea. We're just going to limit to the United States for now, but if we look, right, the data suggests there's probably 1 billion people worldwide that have untreated sleep apnea. So if we're looking at, penny wise, pound foolish kind of behavior, it strikes me that you may, quote, think that you're saving a little money up front by limiting some of these services, but the health implications actually end up costing us more in the end. So I wanted to ask you, what you know about that and what you'd like for listeners to leave here understanding about, even if we go away from the more rare disease, not that it's not important, like narcolepsy or IH, the central disorders of hypersomnia, but if we're looking at just common things being common, be it insomnia or obstructive sleep apnea, because those are really common. Can you talk a little bit about that?
Sure. So there was actually an economic study-based article that came out about 12 years ago in 2013, which looked at, just talking about sleep apnea to start with, is the impact of not treating sleep apnea on healthcare dollar expense versus impact of treating sleep apnea on healthcare dollar expense. Because most of the time, we feel that if we treat, it's going to be more expensive than if we don't treat. Well, it's just the opposite in the sleep apnea world. If you don't treat sleep apnea, the downstream negative healthcare effects, such as hypertension, heart disease, stroke, glucose dysregulation, is far more than if you treat sleep apnea, and actually creates to about half, maybe a little bit more than half, is saved. So when you look at the dollar spent, about $230 to $250 billion for not treating sleep apnea annual cost, and the same population you treat is about, the cost comes down to about $130 to $150 billion. So big savings just for sleep apnea. So very impactful therapy, very impactful treatment from a cost standpoint. Now, if you look at telehealth, it actually further enhances the cost savings. So if you look at real macro, we go away from just taking care of the disease process. We just look at the macro impact. How many miles less do you have to drive for all these visits on a cumulative basis nationally? Just think of hundreds of thousands of patients driving on an annual basis to go see their doctor, who they don't really need to go see them. So there is gas expense, there is expense on time off from work, and as I was alluding to earlier, if you have to arrange childcare for your child, there's an expense to that. So there are all kinds of expenses within the system that go beyond healthcare. Coming back to your point of the not so common disease such as narcolepsy and insomnia, we know that both hypersomnia, which is excessive daytime sleepiness, and insomnia have, again, it's kind of like multiple tentacles of negative effects. So it affects productivity, it affects mood, it affects mental health, which is a massive, massive issue. If anything COVID has brought out is this mental health issue. So taking care of these things and giving them in an efficient fashion, in a timely fashion, and giving access to the patient helps for those expenses. So multiple uses, actually usefulness, if you will, on the expense side for telehealth.
I just love that answer because it is so comprehensive. And anyone listening here, whether you're a healthcare provider or a patient, just know that I'm bringing this up and I'm bringing guests on here to shed light on pull the curtain back, what's really going on behind the scenes, because this should be a right to you to have access and an affordable access to care. And telehealth is incredibly affordable. just from the standpoint of what you need to do as a working person, the convenience aspect of it, and the access aspect of it. So if there's anything that you guys can do, please make sure that you pay attention to those people that are making the policies and the rules for you, and help us continue to advocate for a right, which is access to your sleep provider or any other provider for that matter. But we'll focus on sleep just for the purpose of this discussion, because you should have access to a telehealth provider. You should. That should be an avenue by which you can get treated. I mean, I can tell you, I have had a lot of patients who, quite frankly, wouldn't have taken the time to go see the doctor, but they made the time quite simply because they're like, well, I don't have to take time off of work. Like I could do it on my lunch break. They can see me. Okay, cool. And then I can just go about my day. I'm now still able to put food on the table, and I don't need to worry about the fact that my boss may get mad because I'm taking time off and all the other things that people do worry about in 2025 and beyond. So thank you very much. This has been a real pleasure. And I'm excited to get this episode aired. And the Journal of Clinical Sleep Medicine, it comes out?
It comes out February 1st, exactly, when the journal gets published, yeah.
Yeah, February 1st. Okay, so I will have a link so that you can actually read the position statement yourself. And, stay tuned for more fun episodes.
Great. Thank you, Allison.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleep coaching program, suspect you have sleep apnea, or simply seeking a second opinion, she's available for consultation in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 10-minute review of services today to find out which visit is right for you at AskTheSleepMD.com and start your journey to better sleep with a trusted sleep expert.
Please be advised that the Sleep is My Waking Passion podcast is for entertainment and educational purposes only. It does not constitute medical advice. Always consult your healthcare provider for personalized guidance. For my full disclaimer, please visit AskTheSleepMD.com, and while you're there, don't forget to sign up for my free newsletter. Sweet dreams and happy listening.